Hi everyone, Raif Derrazi here, and this is your latest weekly HIV news video. Today I'll be covering 11 articles covering topics ranging from a protein discovered to aid in the, quote, shock and kill approach for a potential HIV cure, poppers raids, measles immunity lagging in HIV communities, a judge intervenes to roll back research funding cuts, stigma in clinics, and a new drug, Lenacapavir, that could change the future of prevention. All right, diving right in. Number 1, Xtra Magazine. The US government is coming for poppers again. In a troubling escalation of government scrutiny, the US Food and Drug Administration, or FDA, recently raided Double Scorpio, a popular brand of poppers, a chemical inhalant widely used in queer communities for enhancing sex and inducing euphoria. Specifically, it can aid in relaxing the sphincter, making anal sex easier. The raid, carried out under the Trump-era administration and overseen by controversial FDA figure Robert F. Kennedy Jr., forced the company to shut down, sparking fears of a wider crackdown on queer pleasure and culture. Poppers, which contain alkyl nitrites, have been a staple of LGBTQ nightlife and intimacy for decades. While the FDA cited a few injury reports, just 20 ever, and only 6 between 2020 and 2021, many view this as a politically motivated move. This raid isn't isolated. It reflects a decades-long pattern of surveillance, moral panic, and legal gray areas around poppers in the US, UK, and Canada. Whether this signals a larger crackdown remains unclear, but it sends a strong message to queer communities. Pleasure is political, and it's once again under threat. I've covered this previously closer to when this raid actually took place at the beginning of this year, but it's important to highlight again in the context of everything we're seeing now related to RFK Jr., funding cuts for HIV research, prevention and services, and so on. RFK Jr. has repeatedly claimed that poppers have some causal effect contributing to AIDS, claiming before that HIV is merely a, quote, passenger virus, or in other words, HIV is real and it exists, but it's not actually what's causing harm to the body. In his recent book, The Real Anthony Fauci, RFK Jr. now at least concedes that HIV is a cause of AIDS, without fully admitting that HIV is the cause of AIDS. If you're confused about the legality of poppers, I don't blame you. Poppers is legal for non-consumption or commercial use. For example, as a video head cleaner, I don't even know what video head cleaning is, leather cleaner, air freshener, it's not legal for recreational use. But now, enforcement of a law that has been in effect since the late 80s, early 90s is suddenly being prioritized. Number 2, The Guardian. I don't want my boy to be positive. Pregnant women face sky-high viral loads as cuts hit HIV care in Africa. In South Africa, recent U.S. funding cuts to HIV programs are already having dangerous consequences, especially for pregnant women. Zola Medicani, born HIV positive and now 7 months pregnant, was unable to get her antiretroviral medication for over 2 months due to staffing shortages at her clinic caused by a halt in U.S. PEPFAR funds. Her viral load is now dangerously high, putting her unborn baby at serious risk. I don't want my baby to be positive, she says. This crisis stems from the Trump administration's suspension of foreign NIH sub-awards and PEPFAR support, which has halted groundbreaking HIV prevention research, such as a PrEP study for pregnant women led by UCLA Dr. Devorah Joseph Davy. That study alone trained 224 healthcare workers and helped reduce infant HIV transmission to just 2.6%, a major drop from 15% in 2008. But as Davy warns, without PrEP, ART, and other interventions, we will see rates of mother-to-child transmission increase. Clinics are already seeing this unfold. 3 babies in Davy's study were born with HIV in 2024. Now, 3 were born with HIV in just the first 5 months of 2025, even before cuts have fully taken effect. As HIV care collapses, frontline workers like Sister Sibongile Makaba fear a return to the dark days of the epidemic. Quote, "We are going to see mothers dying again. We are going to see babies born HIV positive." End quote. Number 3, the eye paper. Specsavers turned away customers with HIV due to misguided safety fears. Jason Reed, a 44-year-old man living with HIV, was recently denied earwax removal treatment at a Specsavers clinic in the UK after disclosing his HIV status. Despite being on effective antiretroviral therapy that makes the virus undetectable and untransmittable, the audiologist cited guidance from the British Society of Audiology, or BSA, which vaguely warns against treating people with communicable blood diseases, but doesn't explicitly mention HIV. Medical experts, including Dr. Tristan Barber of the British HIV Association, confirmed there is no scientific basis to restrict people with HIV from having earwax removal, stating the risk of transmission is zero. Specsavers has since apologized and pledged to review its policies in collaboration with the BSA. This case has sparked broader concern from organizations like the National AIDS Trust about ongoing stigma and misinformation in healthcare, with Reed stating, "I had this horrid feeling that I'm not equal to other people, that maybe I'm dirty." And if you think this may be an understandable oversight for a mom and pop shop, I'll share with you that Specsavers is one of the largest privately owned companies in the UK, with over 1,000 branches worldwide, 933 of which are based in the UK, employing over 40,000 people worldwide, and a fiscal year 2024 revenue of over £4 billion. This kind of egregious medical oversight is not even the tiniest bit acceptable. Number 4, Nature. Judge rules against NIH grant cuts and calls them discriminatory. A federal judge in Massachusetts has ruled that the Trump administration's mass termination of NIH research grants was illegal and discriminatory, particularly against studies involving racial minorities, LGBTQ+ health, and DEI, diversity, equity, inclusion. Judge William Young called the grants cuts racial discrimination and discrimination against America's LGBTQ community, and ordered NIH to reinstate about 800 of the more than 2,400 canceled projects. Public health specialist Katie Edwards, who lost 6 grants, called the decision spot on, highlighting how these cuts were erasing vital research. The judge also condemned the process behind the terminations as bereft of reasoning and arbitrary and capricious. While the Department of Health and Human Services plans to appeal, the ruling offers a major pushback against politically motivated interference in public health funding. And the 800 that were reinstated were not chosen for any other reason than that they were plaintiffs listed on the lawsuit. As for the remaining, however many, let's see, there was 2,400 total, so the remaining 1,600, those are yet to be determined. I know more than a handful of people personally who have shared that their funding was suddenly cut because their HIV research was focused on the trans community or minority communities of color and so on. And reinstating 1/3 of the funding that was cut is a start, but I have to wonder how much of that will matter to the research that was stopped. I mean, doing proper research often relies on being able to collect data at very specific intervals of time, or keeping cell cultures alive, for example, for the entire duration, or being able to continue to pay the bills or the payroll to continue the research. And if there's a gap in any of these steps, it can mean the end of your research, even if and when funding is reinstated. In other words, in many cases, the damage has likely already been done. Number 5, rough draft Atlanta. Judge temporarily blocks executive orders targeting LGBTQ, HIV groups. A federal judge in California has temporarily blocked 3 of Donald Trump's executive orders that threaten to strip funding from nonprofits serving LGBTQ communities and people living with HIV. The case, San Francisco AIDS Foundation versus Trump, was led by Lambda Legal and 8 other organizations across states like California, New York, and Wisconsin. Judge John Tigar ruled that these executive orders, 2 targeting DEI efforts and 1 aimed at transgender rights, violate constitutional protections. In his 52-page decision, Tigar wrote that the government cannot weaponize congressionally appropriated funds to single out protected communities for disfavored treatment. The ruling protects critical health care services while litigation continues, with Lambda Legal's Jose Abrigo calling it a critical win for marginalized groups at risk of losing life-saving support. Number 6, Stat News. HHS reverses hundreds of CDC firings. The Trump administration has reversed its decision to fire over 450 CDC staffers, many of whom worked in critical public health areas such as HIV prevention, STD control, environmental health, and global disease response. These cuts were part of a major downsizing that reduced the Department of Health and Human Services from about 80,000 to 60,000 employees, with significant layoffs at the CDC, NIH, and FDA. Now, divisions like the National Center for HIV, Viral Hepatitis, STD, and TB prevention, and the Global Health Center are being reinstated. HHS Secretary Robert F. Kennedy Jr. admitted that at least 20% of the cuts were, quote, mistakes, end quote, saying it was always the plan to bring some workers back. Well, here's the thought. In the future, you can prevent the mistakes and disruption in the first place by taking a level-headed approach to the firings to begin with. But I suspect that the chaos and confusion of the initial cuts was part of a larger strategy to scare people and assert some kind of alpha dominance. Number 7, the Body Pro. Why are primary care guidelines for people with HIV so important? The HIV Medicine Association and Infectious Diseases Society of America recently released updated 2024 primary care guidelines for people living with HIV, led by Dr. Michael Horberg and Dr. Melanie Thompson. These guidelines are vital as more people with HIV are living longer and facing aging-related health issues like cancer and diabetes. The update includes guidance on cancer screening, STI prevention with doxypep, mpox, and managing metabolic complications, with new data from the Reprieve study on statins. Designed for both HIV specialists and general clinicians, especially in rural areas, the guidelines also emphasize creating stigma-free, welcoming clinic environments. Dr. Horberg suggests time-strapped providers focus on printable tables for quick access to lab schedules, screening checklists, and immunizations. Even if you can't take a full CME or continuing medical education course, the tables can guide you in providing great care, he said. And I'll vouch for that too, because there's been more than one times where, I've come to my doctor with something and said doctor was like, here, let me do a quick search on the NIH website on what other guidelines, and they just look right then and there. For example, I'm going to Kigali, Rwanda on July 7th for the International AIDS Conference, and I had to go get some vaccines in order to do my travel. And what did the doctor do? The doctor looked up the vaccine guidelines at the NIH. So this is very much a thing. Doctors don't just keep all the information in their head. They rely on these tables and graphs and clinical guidelines. And I'm looking at the changes in the guidelines, specifically this year's guidelines versus the previous ones, to see what those changes are. And maybe I'll do a video going over those guidelines and specifically what the changes are, if you guys are interested. So let me know in the comments below. Number 8, the Body Pro. Measles immunity severely lags among people with HIV in large urban U.S. clinic. A new study from Parkland Health in Dallas found that only 11.2% of over 13,600 adults living with HIV had documented or presumptive immunity to measles, despite being in a well-resourced Ryan White-supported clinic. The research, led by Dr. Hayden Andrews and published in Clinical Infectious Diseases, reveals serious gaps in preventive care, especially during the ongoing 2025 measles outbreak. Among 310 tested patients, 18% were measles seronegative, and most didn't receive follow-up MMR vaccination, even when eligible. Younger age, white race, and low CD4 counts were linked to lack of immunity. This is a clarion call for HIV providers, said Dr. Benjamin Young, warning that poor documentation and missed vaccination opportunities could put immunocompromised patients at risk for severe outcomes. The study urges clinics to immediately assess measles immunity and improve preventive care efforts amidst rising vaccine information. Folks, especially now, I urge you to talk to your healthcare providers about your vaccinations. Make sure you're up to date. With measles cases on the rise, we can't rely on herd immunity like we used to, and it's so important, especially if you're immunocompromised, to make sure that you give your body the best defense against diseases like measles. Number 9, Walgreens Boots Alliance. Walgreens and KFF's Greater Than campaign to offer free HIV STD testing in stores on June 27th. June 27th, that is on Friday or 2 days after this video goes live. Walgreens and KFF's Greater Than HIV campaign will host the largest ever National HIV Testing Day event, offering free rapid HIV, syphilis, and hepatitis C testing at over 575 Walgreens stores nationwide. Backed by more than 415 local health departments and community partners, this initiative marks a record level of participation in the program's 15-year history. Testing will be done on-site in private areas, with results available in 20 minutes or less, and no appointment required. KFF's Tina Hoff emphasized, this year's record-breaking activation shows the power of public-private partnership, also noting a focus on newer prevention tools like PrEP and doxypep. With over 22,000 rapid tests donated by top manufacturers, this effort comes at a critical time as syphilis and other STDs continue to rise in the U.S. Please go get tested if you've been reluctant because you don't want to go to clinics that specialize in this, you don't want that association, or you're worried about having to pay, you don't have the funds for it. Now's your chance to go in a very anonymous way, No appointment needed. You can just walk in for free and get tested in private, get your results in 20 minutes or less. Number 10, Medical Express. Key protein enables the shock and kill strategy for HIV latent virus clearance. And this is working towards an HIV cure. In a groundbreaking study published in PNAS, or Proceedings of the National Academy of Sciences, researchers at the University of Hong Kong's LKS Faculty of Medicine have identified the protein BRD9 as a crucial key to unlocking HIV-1 latency, an important barrier in curing HIV. By screening 280 epigenetic compounds, the team found that inhibiting BRD9 not only reactivates dormant HIV in immune cells, but also enhances the effectiveness of existing treatments when combined with other latency reversal agents, or LRAs. BRD9 competes with the HIV-1 TAP protein for binding to the viral promoter, directly regulating gene expression, said lead researcher. The study also highlighted a strong synergistic effect between BRD9 and BRD4 inhibitors, paving the way for more effective shock and kill strategies that aim to flush out and destroy hidden HIV reservoirs. I've mentioned shock and kill before. This is the idea that the reason why we aren't able to cure HIV is because some of the HIV is latent or sleeping in our body, and the current treatment medication can't find the sleeping HIV. So the idea is if we can wake it all up, then the current HIV treatment medication can find all the HIV, target it, eliminate it from the body, and therefore a cure has been found. Number 11, NBC News. FDA approves powerful HIV drug that nearly eliminated spread in clinical trials. The FDA has approved a groundbreaking HIV prevention drug called Yeztugo, or otherwise known as Lenacapavir, a twice-yearly injection from Gilead Sciences that showed near total prevention of HIV in clinical trials. In one study, among gay and bisexual men and transgender people, Yeztugo reduced HIV rates by 89% compared to daily Truvada. And in a separate trial involving cisgender women in sub-Saharan Africa, not a single participant contracted HIV. Advocates hail it as the biggest opportunity in over 40 years, with Mitchell Warren of AVAC calling it the single best opportunity in 44 years of HIV prevention. However, its potential impact may be limited by steep costs at $14,109 per injection and deep federal budget cuts to HIV prevention under the Trump administration, including a proposed 35% cut to domestic HIV funding and elimination of the CDC's HIV prevention division. Access barriers like insurance coverage and provider follow-through could also widen racial disparities in PrEP use. Still, providers like telehealth startup Mr. are gearing up to offer it in major cities, and Gilead has committed to covering out-of-pocket costs or offering the drug free to uninsured patients. Time will definitely tell what is going to happen as far as how they're going to structure the cost for this in high-income countries, middle and low-income countries, and whether there are going to be discounts available or how this is going to play out. And advocates and activists are going to play a huge role in how this all pans out. Those are your articles for this week. Links to all these articles can be found in the description box below this video. Sign up for my mailing list. Link to that is also in the description box below this video. Guys, I have seen some comments about some of these articles being doom and gloom and lots of bad news, but also I hope you're heartened to see that there are articles where things are being turned around. Judges are intervening. We have checks and balances in the US for that reason. I just want to keep you informed, and I want to inform you also of the good, not just the perceived bad. Be sure to like this video, subscribe if you haven't already, hit that bell so you get a notification every time a new video comes out, and please share this with anyone who might find value in this content. Those are all the best ways that you can help support me and my channel, and I'll see you next week right here for the next HIV news video. Cheers.